Yeah, one of the things I want to talk about is health-based standards. But, because what do you do? Well, so we're going to get in here, the group discussion and conference rapid. I'm going to take my position to take advantage of that. And so we've always told folks to follow the MCLs because that's what community water supplies do. That's what all the messaging says is safe, all of those things. So when we go to some other standard for just private well owners, we're creating a huge problem because 82% of the country is using MCLs to tell people water's safe. And now we want to come on and use different standards, health standards. Some come from the USGS, some come from the EPA, some come from a state, some are proposed. Now, everyone's using different numbers that are lower, and so we're telling not only those people, the 82% that live on public water supplies, that they're not really safe, but we're also contradicting our state agencies. We're telling, we're causing a rift with those folks, and you have some state agencies that do both. In Illinois, it's separated. Illinois EPA does community water supplies, our public health department does private wells. But what about Minnesota or New York or states where it's one agency that does all, or DNR in Wisconsin? I think we really have to be careful about the messaging we give folks. I mean, I get protecting public health is the most important thing, but we have to find a way to do that, in my opinion, and I just wrote this all down this morning, so. Yeah, because it's also that people understand the MCLs and all the 40 years of, 50 years of the Safe Drinking Water Act, the 50-year anniversary is this last year, but we're going to create a disconnect, and I think that's really a dangerous thing to do, and so I don't know the answer, and I'm just giving my opinion, but I work on both sides of this fence. I work with public water supplies, non-community systems, and private well owners, and I think it's something that shouldn't be done lightly because it's a lower standard, and unless there's a lot of good evidence one way or the other. So. I'll get off my soapbox for that, and I guess if what topics were most were not covered during the conference you'd like to see, yeah, please fill this out. And does anybody have any thoughts? Just we're here all together, have a conversation. Jesse does. Last thing, very last thing. So. For the E. coli, you have to be here at the very beginning and at the very end each day. Last thing is the E. coli. Yeah, who has the E. coli? Who has? Okay, yeah, it's on my list. I won't forget the E. coli, because one person here who really wants one doesn't have one yet. So, yeah. I'll see what I can do. Okay. So as far as where we go from here, the questions that are in your agenda, takeaways. I know a lot of people said a lot of nice things about this conference because it's focused. We've had recommendations for other things in the past. I'm hesitant to change anything as long as everyone thinks the conference is doing what it needs to do and it does it well, and I think it does. We've had people say, why don't we have 2 tracks? Then we could have more speakers and blah, blah, blah. Well, I think the value is that we're all in the same room together. And I could care less if there's 70 people or 500. No one has to pay for it yet. But I think it's really the networking. It's like, 2 of the speakers couldn't be here at the last minute. They offered to do a video one. I said, no, I don't want to do, I want everyone, it's really the connections we make. And, I won't be here forever, so if somebody else wants to do it differently, I can't stop that when I'm gone, but yeah. But if you have thoughts, we certainly entertain those things. Yeah, and what do we do to elevate this? We'll use health-based standards as an example. How do we elevate this nationally and get more people in the conversation? Because that's really what we need to do, right? Anybody have anything they want to share? Just trying to, because we're all, yeah. Okay. Yeah. Sally's idea. We should have been doing it all the time. Yeah, it was a good time. And we just have to find a way to do that. My concern is we can't pay for it. So, but it was a good solution. And yeah, it was fun. Especially, I mean, I think a lot of folks stayed and did the music bingo, right? That's all I heard about yesterday morning, so.
Veronica mentioned that maybe we could have a poster session.
Oh, that's right.
Encourage youth into our group.
Yeah, that came up last night, right? Yeah, or was that yesterday? Yeah, so and that's a good idea, right? Maybe, to have a poster session and bring more students in. I think Victoria's gone. I don't see her. But she just finished her postdoc in Georgia Southern. And so, and we usually have a couple students every year who someone recommends. And Meredith, she also might be a PhD student, or was she just hired? I can't remember, from Virginia Tech. Oh, there you are. Yeah, you're out of school. Okay, well, either way, yeah. I only have a master's degree, which, you know, that matters to some people. I think they're short-sighted, so that's my 2 cents there. Not that I'm saying how I feel, yeah. Because it really isn't a thing sometimes. No, so I think that's a good idea. And if anybody has any, I've never done a poster session with this and never organized one, so we're always open for collaboration with folks too. So, yeah. Yeah, the well assessment thing, so now it's become more popular, especially because they're doing testing. And so we as a group with RCAP need to figure out a way to, how we were gonna deal with that in the future. Because, you know, all the questions today were about looking at the data, and that's valuable, but there's reasons why it's not publishable and some other things, the way it was set up with EPA. It's really meant to be an outreach and education thing, so you're working with a well owner one-on-one, and you ask them, hey, do you have a backflow device on your spigot? And they're like, what's a backflow device, right? Most people will say that. And so that's a way for you to educate them about why it's necessary. That's the point of the well assessment, not to collect the samples and have the data and then map it and do research on it. It's not a research project, it's an outreach and education program. And so I get the value. You know, like New Jersey has the Well Testing Act. They get 13,000 samples a year from homes in New Jersey. All of us would kill for that data set, right? To be able to use that. So I get those points too. Sure.
Some of it brings an ethical dilemma to me, because a lot of the outreach is under the guises of you want to help the well owner and collect information. And then when that information is used for other purposes, sometimes I think there's a loss between these were human beings that live there. We had some stuff in Michigan, not my department, get published before the well owners knew.
And see, that's wrong, wrong.
And, yeah, that was not us, it was another world. And sometimes, I understand so many, you want so much data, but I feel like sometimes there's just really a disconnect between those people that you see every day when you're out at RCAP, and then you just take those numbers and go,
Right. Well, and this program, RCAP's program, doesn't do that, but we all do, right? Anybody's doing research, I sure have. I've written proposals and got grants. I think it really ends up being the person who's in charge. Are they really trying? You know, like we interviewed 100 programs or 91 programs with a grant we had from CDC about why they, what they found when they were working with well owners as far as why they don't test and what would they do differently, how would they do their outreach differently, all this stuff. And one of those programs had money built in to add treatment for the worst cases. And things like that are valuable. One of my colleagues who's retired now, they got a big grant for healthy homes to look at lead in homes. They actually put money in to replace all the pipes. They replaced all the pipes in 5 people's houses. I mean, who does that, right? It was really cool that they did that. And they added treatment to about 20 others. No, right. Well, you know what I mean? Well owners say, I don't want to know. 8%, Minnesota, Michigan, and Wisconsin, that study that, oh no, it still is. Yeah, yeah, I see it, yeah, okay. Yes?
I just want to say, so I really agree with all that. It's easy for researchers like me just to get all excited about data. So I think it is really important for researchers to engage on the ground. At the same time, I've been able to use large data sets that have been collected and some very sensitive information and
Well, yeah,
If we hadn't had that information, I don't know that we would have gotten the support. We also, again, we met with the mayor and everything. And
sure.
if you, so that, I think.
There's a place for both.
Keep
Yeah.
everybody's data confidential, it might be better for that individual household, but then you lose the power of numbers and advocacy.
Sure, and there's a lot, I mean, I think Sophia mentioned it in her talk. They're collecting information, so they have leverage to go and make a clear case. The folks in Massachusetts, I don't know where Jim's at, but, you know, they got funding from the Health Foundation of Central Massachusetts to collect a whole bunch of data. They went to a bunch of their different health districts. I think they ended up with 300 or 400 samples so that they could go to their legislature and try to get a law passed. And it really took having that information and showing that 40-some% have this and 25% had that then they can make a case and get other people behind it. Now there's this grassroots coalition that's really forcing the state to look at those things to the point that DEP, the state primacy agency, was given a directive by the legislature to develop basically a cost estimate if you went this direction, or this direction with private wells. What's it going to cost the state? What's it going to cost the homeowners? Here's your options. And that document's been published. And so it's an effort to try to get minimum standards for the whole state where you have 351 health districts that all can set their own rules. Some have none, some are really strict. So, Sophia.
Yeah, I wanted to go back to the, talking about the format. One thing that I've seen done really successfully at other smaller conferences like this is at the beginning for networking purposes, have small group discussions where people can opt into a particular topic area, so break down like 10 groups or something, and have facilitators.
Did you put that in here?
I did.
Or on your evaluation? That's the thing, if you think of something or you don't even want to speak up today, you think your opinion may be different, whatever, that's fine, put it in your evaluation.
Because I heard several people that wanted more detailed, like well construction things from like the drug industry and Baroid.
Sure, well, and we had that Baroid guy here because of people asked about grout last year, right?
I've seen many Baroid presentations, and we always preface with the person that's gonna come exactly what we want.
Well, and, right, and we did not do that, and we should have.
They are so not.
No, right. And I know that Jack, who came here, and the other thing is the person who was supposed to be here ended up couldn't come at the last minute, so Jack stepped in. He came over from Washington State. And so, you know, it is what it is. But that is, and I do, a number of you, I think, who spoke will also, it's like, hey, I asked you to speak about this, right? And so, or someone even said, Steve said I should talk about this or whatever, because it's what we think everyone needs to hear, you know. And I think that's important when it comes to, because a lot of us have, you know, a wide variety of experiences. Some of them aren't as relevant and to everybody else, but they're interesting to you. Well, that's not what I want. I want things that are going to be relevant to everybody, which is, yeah, we really try to do when we talk to all the speakers. But yeah, that's a good point. And it's come up about doing roundtables and some of those things. I don't know that maybe I have, but maybe I haven't had it presented like we should do it very first thing so people can figure out who's involved in the same topics. Yeah, might not be a bad idea, but if you think so, put it in the evaluation so we can, you know, if 2 people say it, it's different than if 12 people say it, right? Because there's several things that came up. 1 or 2 people said this. If it doesn't motivate us and our team or me, then it may not make it in there. But if 10 people said it, we would deal with it. So, okay. Anything else anybody wants to bring up? So I've got a list of things to do here, including thank yous. All right, so I want our team to stand up. Sally, Laura, Sarah, some of them are outside. Veronica, Katie, where's Katie? Katie's right there, yeah. You know, all of these folks and the 3 outside have, Hideyuki, thank you. He didn't stand up, I didn't see him. Yeah, everybody's got a role, and we're very fluid. We have grants for different programs, including our water operator and decentralized wastewater. So everybody's doing different things. But like for this conference, it's all hands on deck, and everybody steps in. We meet every week. It's a really great group of people. Someone just told me that last night, how lucky I am to have such a good team, and that it's not lost on me at all. So thanks to them. I don't know if Jenna's here. Jenna Shelton's our director. She's the first director of the water survey that I've invited to our conference who actually came. So that's a big deal, yeah. Is she in here? Jenna in here? Oh, yes, she is. John Scott, I'm not sure where he's at. I know he's around, or he might have left early, I don't know. Mainly I want to say thanks for giving that extra talk. The microplastics talk wasn't on the agenda. We decided beforehand that it was too general, not specific enough about private wells. But then we had somebody cancel, and it's like, you know, it's a great topic. We figured everybody would be interested, and I think it proved itself there. Plus, you can tell how passionate he is about all that kind of work. And Becky Schumann also stepped up and did a lightning talk. I want to thank you for that. Kagan, is Kagan here? Hiding back there? From Gravity Media, they're here locally, but they work all over. This has been very seamless, great to work with. We've brought a guy from the U of I media group to videotape this conference, and then we put him on YouTube. And at the last minute, because U of I graduation ended Sunday, there was no way to get him and his equipment. We figured that out like 4 weeks before. There was no way to get him and his equipment out here and ensure it would all make it by Tuesday. And so we asked Kagan if he could step in. He's got this cool system. We're going to rethink that because it's actually a much better approach probably. So thank you for everything. I'm not sure what I wrote down there. I also wanted to thank Jim Starbird, Jesse Campbell, Cindy Brooks, Frida Von Qualen, and Sally Dolan, and Wilson Mize. What's this one here? I have my glass. Oh, well, yeah. A lot of people needed to go. We're kind of an informal work group. We were working on things like working with the EPA to update their private well page, which has some really poor information on it. Before the administration changed, and that all stopped. But they also do, they help plan this conference. They review all the abstracts. We meet quarterly or try to. And so thanks to them. And RCAP, you know, everything we do is funded by RCAP. They're the prime EPA grantee. We're sub. And so, yeah, they've been very gracious with all these things, and we have the resources we need to do things like this conference and run the private well class. I also want to mention the past videos because things like springs that came up, that assessment is for wells or springs. We developed that way on purpose because there's only a few places where there's different questions to ask, but we also provide best practices like on spring boxes and some of those things. But on our past conferences, we've talked more about both the assessment tool, went through details of how that works. Again, you can find it on our webpage, but also on some of those topics like springs and grout. We had a talk in 2017 from Nebraska. I just want to mention, the videos are worth watching. They're talks just like all the talks that were here this week from different people on different topics, but they're all related to private wells. So I've already mentioned the evaluation 3 times, so I won't do it again. Before we do continuing education forms. Anyone here who is an EHP, or if you want a certificate of some sort for being here, we have those forms in your binders. And I want to mention, if everyone's got their rides and knows what they're doing to get to the airport, great. One of the folks from MAP, which is the state of, I know what it is. Yeah, I was going to say the state of Montana is part of MAP's area, Midwest Assistance Program. They're one of the RCAP regions. William from MAP is here. He's local. He said if somebody either couldn't get on the shuttle, needs a ride, he'd be glad to take him to the airport. And William, are you in here? Yeah, right there. Thank you. And so you can talk to him if that works for you. And lastly, we need to draw for our E. coli. You know, we did that the first year just to get people excited about things. And we had these Petri dishes that are about this big, and they were sealed, and they have 3 little E. coli plushies in them. And they were so popular. And then they stopped making that. So if you didn't get one, you don't have one. You can leave, these you can leave out on the table. We will use them again next year. What I do, I keep every one of these. I bet I've got 600 or 700 of these, just the paper, in a drawer. But the plastic, we will use again. These we will use again. If you want to keep your lanyard, I keep one in my backpack, so when I go places, I use my lanyard instead of, some company's lanyard. But anyway. Say it again? Just out on the table out here, or you can hand it to one of our staff. Thank you. Okay, so the drawing for the E. coli. All right. Jesse shut out again. We haven't been, hey, we've only had 4 in-person conferences, so I'm not sure where you're getting 11 years from. Yeah. Hey, thanks everyone. I'm going to be around. If anybody, we're going to tear down our booths and all that other stuff. If anybody else is around, wants to just talk, I'm always glad to talk about private wells and stuff. Thanks everyone who came. Hope to see you all next year. All right, thank you.